Good day. The situation of COVID-19 has not changed in the world. Close to 4 million people and precisely 3,997,047 people have been infected, or total have been infected by the disease worldwide, with 1,350,764 recoveries and 279,023 deaths thus far. America remains the hardest hit country with 1,309,441 and with as many as 78,794 deaths. The European continent remains the hardest hit continent with about 1.5 million people infected, but with 151,501 deaths. Africa has been infected also, but the good news on the African continent is that there are a number of countries who have been infected, but we've not recorded deaths in those countries. They include Madagascar, Eritrea, Namibia, Seychelles, and Mozambique. They too have been infected. The situation in Cameroon is quite encouraging. Cameroon is the first country in terms of the number of patients that are recovering from the disease. But as of today, Cameroon has recorded 2,265 confirmed cases of the disease, with 1,000 recoveries this far. As concerns deaths, 108 from the statistics that we have. We will be talking about that, look at the social impact of the disease and why Cameroonians are changing their attitude in spite of the fact that the situation is not abating or the curve hasn't flattened or going down in Cameroon in terms of in infections. And this is an infectious disease. We hear that the situation in the West region is not very comfortable, particularly in the known division, where people disregarded government advice for them to stay away from gatherings and also congregations like worship programs. And so that has led to a rise in the infection in the known division. The governor of the West region was there the other day. To talk about that on the program this midday, we have Professor Emeritus Paul Nkwi, who is an anthropologist, with us on the program. You're welcome, Prof.
Thank you.
We have our usual man on the beat who is following closely what government is doing, Dr. Eric Tandy. Doctor, you're welcome.
Yeah, good day.
You give us an exact situation of what is happening. And we have a political scientist who would certainly tell us why government took the mode or why governments behave the way they behave in certain situations. That's our political scientist this midday is Professor Elvis Ngolengole. You're welcome.
Thank you.
I'm not inviting you today as a politician, but a political scientist.
Thank you very much.
Okay. I'd like us to begin with what the papers we're feeding on this week. The press review, and it's done today by Leoti Kale Lisonge. Emmanuel Aviemnu has a code, but we hope that she'll be with us next week. Leoti.
Talk on the coronavirus keeps animating the papers. This week, we walk you through some major headlines, particularly those on the socio-economic impact of the virus as reported in the newspapers. The Star newspaper, for example, presents President Paul Biya fighting COVID-19 with a pen in a story captioned, "After evaluation meetings, Biya adopts new measures on COVID-19. Why? Because Cameroonians are suffering economically and their businesses too have been paralyzed. The same paper reports on the coronavirus causing inflation as drivers were threatening to increase transport fares. Thankfully, government's 19 new measures to attenuate COVID-19 effects came as a stitch in time. Cameroon Insider takes us in-depth on the issue. From the special allocation of 25 billion CFA francs to companies to cover certain value-added tax costs, to the granting of moratoria and deferrals of payments, and the increase of family allowance from 2,800 CFA francs to 4,500 CFA francs. Measures that have been greatly appreciated by actors in the sector who consider it a way of relieving them of certain burdens. While others hail government's prompt reaction, SMEs still cry out. And there are those who think of it as a decision that instead opens the doors wider for a rapid spread of the coronavirus in the country. The Chronicle Times puts one of such individuals in the spotlight. The story goes thus: easing of COVID-19 preventive measures, how Dr. Nicholas Ngwanyam got it wrong. According to him, Cameroon should copy and paste from the Western world by keeping leisure spots locked, thereby limiting the spread of the virus, a point of view indicating that government has definitely relaxed the previous 13 measures to contain the coronavirus, but not quite valid, as Cameroon Insider reminds that the wearing of face masks and social distancing is still in vogue. Unfortunately, according to the Guardian Post, it is a sad fact that social distancing remains a problem, with some persons unable to adhere. Their comportment further compels the publishing of an article by The Star, emphasizing that they are face and not chin masks. In a later edition of Cameroon Insider, a picture of people returning to old habits, partly because government has relieved certain barrier measures, is portrayed. A laissez-faire attitude that causes the horizon to exclaim while educating readers on government's move. A move WHO experts warn not too soon. As if agreeing, the voice highlights the fact that government lifts restrictions even as COVID-19 cases rise. So far, 8.8 billion CFA francs has been spent in the COVID-19 fight. Meanwhile, COVID-19 aggravates the global learning crisis as more than 1.6 billion scholars are out of school in 161 countries, which is close to 80% of the world's enrolled students. Though schools are set to reopen on June 1 in Cameroon, the Post and the Horizon newspapers have made it clear that only those in examination classes will resume based on the information pieced together from the authorities. Inasmuch as efforts are being made to tackle the socio-economic impact of the COVID-19 pandemic in the country, the effects can hardly be avoided, as the Guardian Post headlines. PCC slashes teachers' salary by 50%. At a time, private school teachers are protesting on the Post against the non-payment of their salaries for 2 months. In the face of all these, the Guardian Post reveals that the coronavirus obliges BEAC to dangle a devaluation hammer over the franc CFA, a tough call for the institution reportedly torn between the need to offer financial support for the economies of the countries in the sub-region clearly in need of funding to cope with the impact of COVID-19 and the duty to preserve the parity between the franc CFA and the euro. While BEAC struggles with indecision, the underlying fact is that the coronavirus is rippling economies. As if in Q, Municipal Updates published an article wherein containing the spread of the virus, COVID-19, overrides the development plans of mayors who have shifted their priorities from the rehabilitation of roads and the construction of bridges by diverting the funds to combat the coronavirus in their localities. Meanwhile, the IMF, UNDP, Global Fund and other organizations keep pumping money in to help the economy thrive the coronavirus era. As a result of the pandemic, the UN has equally suspended the voluntary repatriation of refugees from the Central African Republic. The Guardian Post has also reported that as COVID-19 bites harder, the Food and Agriculture Organization has brought to the limelight that over 19% of the population in conflict-hit regions are threatened by food insecurity. The fight, however, continues as government is now prioritizing investment in the pharmaceutical industry to contain COVID-19 pandemic. And some world leaders have pledged for a common COVID-19 vaccine to combat the virus. Amidst the hurdles, Cameroonians still have reason to smile, especially with the reorganization of the Limbe Autonomous Port and the reconstruction of the northwest and southwest regions. The papers also honored media men and women this week as they celebrated the World Press Freedom Day on the theme, Journalism Without Fear or Favor. If you're just joining us, don't move a muscle, for this is the moment when expert analysis will thrust you into what made news in the print media this week.
Thank you, Yoti. I'd like to begin with you, Dr. Eric Tandy. Are you people in the Ministry of Public Health aware that the public is disrespecting the barrier measures? Or increasingly disrespecting, they are increasingly disrespecting the barrier measures?
Yeah, that's true.
Have you observed that?
We've done that. We've done that, and we've tried to communicate on that many times. Maybe I should give update on some of these issues, because the week or the past week has been very busy as usual. And what was very specific for this week was the minister going down to the field to take stock of what is happening, not only on COVID-19, but with other health-related issues that panic has caused a lot of, or a part of the population not to get into health facilities again because of fear. So the minister actually goes down to the field to evaluate that have health personnel abandoned their duty and now allowed only the isolation section of health facilities to function. In that case, the answer was no. And we went back now to the field to communicate, to ask the population to continue to respect the measures that have been put in place, as well as other health issues that shouldn't keep them away or in their house because of the fear of COVID-19. And again, the minister didn't end there. The Secretary of State actually went down to the field. He was in Southwest and Littoral region to evaluate the situation, especially on what level the COVID staff that are on the ground or COVID response plan that have been disseminated or decentralized. By so doing, he had meetings, consultative and evaluation meetings with the governors who are the president at the level of the regions, and then with the regional delegate and his team, as well as the various treatment centers, to actually see that this is being put in place. But now with the community, where I'm coming to, we've noticed that after the government measures, there was a little bit of misinterpretation. I want to put it in quote because we've realized some people abandoning the face masks and not respecting physical distancing. And then here, intensification was done on sensitization so that the population should understand that the government didn't say that you should take off your face mask, or it didn't say do not respect physical distancing. I think this one will stop them from not washing their hands or not respecting other measures. So these were some of the issues that we lay emphasis on as a technical ministry that the population need to understand. And this, because we have a very huge sensitization team that is on the ground. And especially with the organigram of the Ministry of Public Health as a technical ministry, we have right up to community and even zones where we have community health workers, and they are doing just their job as far as sensitization is concerned.
If I'll go to the anthropologist. If the public is behaving that way, these either are not convinced that there is a danger in public, or they are simply disrespecting what government is saying, not knowing the consequences, or is government not communicating enough?
I think basically human behavior is built over a whole lifetime. It's virtually from cradle to the grave. But unless there is a major social tsunami, people don't change. They go on to behave the way they have until there's proof that they need to change that. Let me quote you a few examples. In one of the African countries, in 2000, an epidemic of cholera took just 3 months to kill 3,000 people. Just cholera. People didn't know exactly what was going on. And they asked, I was privileged to go to that particular location, spend a few days and weeks with epidemiologists, public health experts, to figure out what has actually happened. What did we find? The cultural practices that are imposed in the treatment of the dead. And once people, and what has happened is that when a person dies, there's a specific treatment of the body. The body cannot be buried until you have finished destroying his property. And what do you do with the body? You have to conserve it. People have to show some mark of respect. And in the course of that, many people were infected.
Okay, so
what is happening in our situation that we have to preempt that, because we will, as the epidemic is slowly progressively attacking our population, we will continue to see many people die. And what we will be saying, they would have to draw back and relent from using traditional methods of treating the dead due to the virus. This is critically important.
I know that exists already because the public health authorities don't allow the bodies to family members to bury them. But the curiosity here is with the attitude of the people there are others who say that they don't believe because they haven't seen a patient.
That is true because, to change people's behavior, there must be like I say, a cultural, a social humanity that shakes that behavior. As long as there's a couple of people who are dying and there is no immediate impact to the individuals, they continue to do what they have been doing. And this morning, I drove through Mokolo Market just to be able to see who is respecting the regulation to carry the mask. Virtually people are going on as if nothing is happening until it hits.
What should government do now? Continue to communicate or should they take repressive measures?
Normally in social behavior, if there is a prescription and there is a sanction or penalty, people usually follow. Normally, even in any society, if a sanction is not attached to the prescriptions you have been, to the new behavior you're introducing, people don't care. And I think this is fundamental to say, okay, if everybody has to carry the mask, let them do so.
I know I stopped you from carrying the mask here this morning.
Now, for example, I was going to ask ourselves, why is it that we are not following the government instructions?
Everybody here has a mask, but we're maintaining social distance, and we've been controlled and disinfected. So
I don't think it's social distance. This is a word that I don't normally
physical distance.
The most important thing is because social distance simply implies flexibility. The closer you are to the person, the more the distance reduces. But the physical distance where you say it's a meter, where the droplets cannot reach the next person, I think we should insist more on the physical distance. Right now, between him and myself, we're only probably a meter away. We should be 1.5 meters. So social distance, which is a term used just to push people to keep a little bit of a distance. Now, if you're in a bar, how do you maintain the social distance?
Or the physical distance?
The physical distance. Exactly.
Okay. I think that's where the problem is, and that's where many people are saying that those who frequent bars usually forget about their health situations because they're moving healthy and they can move out unhealthy. Emmanuel.
That's true. I think I've had a lot of the explanations by both the first two panelists has been very important, like the Minister of Health, which is taking various measures, to curb the progression of the disease. Like also the Professor Nkwi, who is explaining some of the...
Now, there's one thing. The South African government said, we will not borrow from them anyway, but this is just an example. They said, we will not relax the restrictions on the smoking of cigarette and alcohol because cigarette smokers are very generous. And so they would easily toast.
That is a very big problem. I don't cover, actually I cover I cover CEMAC.
Yes.
Already South Africa is already a very good example.
Let me coin the question. The people who argue that way say that government was supposed to look at some specific areas where which people can use or which can make people fall into this virus very easily, and that's targeted areas so that you don't relax such areas like bars, for example, that people should do what the name implies, vente emporter in French, which is buy and carry away.
This is an area where the scientific value or evaluation of social behavior is trying to look at a pandemic which has surprised every human being. What we need to know about the COVID-19 is the fact that everybody has been taken by embarrassment. See, first of all, the South Africans, they like to enjoy themselves, just like we have in the U.S. They like to enjoy themselves. In the U.S., there's a very big problem. South Africa is even a small case because already in the U.S., you have over 75,000 people who have died, and you have over 100,000 people who are already, who are sick about the illness, which means they are potentially going to die. The issue about
the recovery rate is higher.
I mean potentially means that you can die just like you can survive.
Exactly.
In essence, the South Africans are still to understand the weight of COVID-19, and the WHO is giving a very powerful message to Africans to be careful about the way they socialize. Social distancing, like Prof was talking about. I
prefer that we begin to use physical distancing.
Exactly. I think I really like the way Prof put it. It's very important. The idea is to be, well, social distancing was a subtle way to say, please don't be too close socially. I think that's how the concept came about. But I think the real word, like Prof puts it, is physical distancing. You have to keep your physical distance. Why? Before I go to answer your question, Joe, excuse me, it's because one of the major things that we have about the COVID is because when you speak, if you are contaminated, the first easy way for you to be contaminated is to get somebody else's spit or excrement from the nose, to attack, to land on somebody else around the nose or the mouth, and the person automatically may become very easily contaminated. That's why we wear the mask, as Prof was explaining. Let's go back to your answer. The issue about South Africa, sorry, to your question. The issue about South Africa is that they like to enjoy themselves, but they fail to understand that this is a period where enjoyment has been kept. On the global scene, hardly has anything ever happened like this apart from the period of the Noah era in the Bible that we know. I don't want to talk about religion here, but the Noah era of the rainfall, which exterminated almost everybody, has become the real phenomenon. Today, let's look at the COVID-19 as a rainfall which is dumping on mankind, because almost everybody can die. That's a scenario. And so let's look at it as a way of trying to prevent our being together, because the connection that is transmitting the disease is about connectivity. Why do we have economic rundown? It's because we have a case where people cannot go to work because they cannot be together. Everything about togetherness has been split because of the COVID-19. Okay. If you are together, just be sure that you are not sure about the next moment about your life. Okay. So South Africans should be careful about how to carry out their enjoyment as they claim. Cameroonians like enjoyment. And I remember very well,
yes, I will come back to the social impact of it. I was using that because the South African example, when I wanted to see whether we can draw from their own experience, they are targeting specific areas.
You don't target. Permit me to cut you short, Joe.
And alcohol.
Joe, please, in this case, you don't target a specific area. When the government gives
you want a global response.
First of all, take a global response. The government will take time to observe how the disease is progressing, how people are looking at it, and then we start seeing whether we can open up here or open up there. That's the scenario.
All right. Dr. Tandy, you wanted to chip in something before I come to Professor?
I just wanted to say, like the technical ministry, as far as this is concerned, we shouldn't say people shouldn't cooperate. We now have technology where people have to communicate. We can now communicate freely and fully. A little bit away from what he said, it's not time for us to socialize. There are so many ways to socialize, but we have to respect the measures that have been put in place. You see, because the economy must continue, the population must continue to live together, but we should base our cooperation, our connectivity more on phones, on the technology. I think that is very important. But taking note of respecting the measures that have been in place. Physical distancing, wearing of face masks, as well as staying at home and watching TV or doing other activities.
Clean your hands off as often as possible. Yes, Prof.
Let me just chip it before you move on. We're talking about the informal, the formal economy, where it's well structured. But the informal one is where we have the problem.
Okay.
Go down to our markets, whether it's here in Yaoundé, in Garoua, Bamino. The local people, poor people, are struggling every day to be able to sell their plantains, cocoyams, etc. You go to Mokolo. I was there this morning. And you can see that here is a group of people. You cannot keep them at home. If you keep them at home, you're merely saying they will die of hunger. We need to study that and see how government can address that issue.
Okay.
There is
I'll be coming to that shortly.
There is a Cameroonian in the U.S. who received a check of $1,200 given to him by the state to cushion off the economic impact. And he was very happy. He didn't expect Trump to be so generous. So my question is to government is, how can we help these people in the informal
shock-absorbing measures?
Exactly,
okay.
this informal sector.
Yes, I'll come to that. But let's finish with the first part of our discussion, which has to do with what's happening in the community today. There are people who say that government was looking at the trying to guard against maybe social unrest. What guides government in taking decisions in critical moments like this?
Well, Joe, I would like to begin by, and with your permission, by expressing my condolences to the family of our friend, colleague, and comrade, Mr. Simon Mayanga.
I know. We were supposed to say that at the end of the program. As a member of your party, you have a
member of the party and a friend and a comrade. We wish him well, and we know that he's in God's hands, and our condolences go to the family. Now, as to your question, Joe, I mean, what we are discussing here goes to the center of the raison d'etre of what statehood is all about. You know, the way that the world of humanity is organized today, and ever since, if you take since the days of Westphalia, the states are the highest level of collective authority, politically speaking, legally speaking, constitutionally speaking. And apart from the United Nations, which is like a world government of sorts, but whenever a people, anywhere in any corner, in the post-colonial sense, because in the pre-colonial sense, and Professor Nkui can attest to this, the highest level of collective political authority is the state. And whenever a people in any given corner is faced with a global danger, global threat, anyway, they don't look at the component part for a solution or for safety. Everyone looks at that ultimate collective authority that can bring a solution or that can bring safety. And in the world in which we exist since the days of Westphalia, it is the state, and that is why in all political societies that you call countries, call them states, whenever a danger, be it a natural disaster, be it a public health danger such as COVID-19, or be it whatever, everyone looks forward to the state, and the state must come forward to take charge, and states do that better than any of the component parts of any state. That is why in the case of Cameroon, you've just said earlier, and I'm glad you said that the case of Cameroon, in spite of these numbers, is quite encouraging if you look at comparatively speaking. Why? Because the state of Cameroon has taken charge, has shown that it has the muscle to be in charge and to be able to bring that solution, that safety to the people of Cameroon, because this thing affects everybody. It doesn't matter what political party you come from or what village or tribe. It's attacking everybody, and everybody is afraid. And the only person who can bring solace or a sense of safety to everyone is the state, and we're quite glad that this is what we are seeing. We are seeing a strong, effective state leadership through the government, of course, of that state.
And so, obviously, to my question now.
Yes.
What then guided government's response in relaxing some of the measures, the confinement,
Yes.
that's providing the 19 measures.
Yes, I've had cause to say earlier, faced with this sort of global danger, or public threat that brings panic everywhere, different states have different ways of providing solutions or providing safety, depending upon the texture, the type of state there is, because there are different types of states which have different textures.
Indeed.
Generally speaking, closed societies or states which have political systems that are closed, meaning repressive, anti-democratic, dictatorial, and so forth, they could do it by being repressive. And it solves it's easy to do that and put everybody in prison, lock everybody up, or say nobody moves 1 inch, because that's one way of solving the problem, and they tend to do this easily.
Okay.
But states that are open societies, democratic societies, competitive systems where freedoms are considered as a value, such as we have in Cameroon, such as the United States, South Africa, and so forth, states have to do it with a little bit of care, because you have to strike a balance between, Professor Kri was saying earlier, between the nature of the people as human beings, between the fact that people are used to freedoms, people are used to, like in the case of South Africa, enjoying themselves. In the case of America, Britain, this is what's happening in Cameroon.
Yes. Now,
the state has to strike a balance, and striking that balance.
Yes, let me come in.
There is no repression, because...
Let me ask you another question. Yes. Does that explain why some governments are more stringent than others?
Yes, because the more open, the more democratic, the more liberal the system is, the tendency is to be a little more lenient, a little more liberal, taking into consideration these sensitivities like the nature of the people, the fact that the people are used to certain freedoms, and making sure that even if you try to give measures such as the 13 plus 7 now plus, you try to, after some time, see that because of, as the Prof was saying earlier, some people cannot do without working, without moving up and down, because they have to live. Yes. What do you do with such people? Bayam Salams, motor taximen, and so forth, hawkers. You have to find a way. If you are a liberal state, if you are a state where you care about the way of life of the people, and that they have to live, because if they are not killed by COVID-19, they might be killed by
hunger.
They've lost the way of livelihood. And the state has to be sensitive to that. So the fact that you have a strong, effective state does not mean that you should be repressive.
Okay.
You should try to be as liberal as
I see. No, excuse me. No, excuse me. No, please. Just hold on. No, he's a political scientist.
I understand.
Yes, I'll come to you. Let me take a hand from Professor Kri.
It's not only Cameroon.
Yeah, of course. It's true.
That failed to take early precaution. It's not only Cameroon. COVID started in 2019, December or November.
December.
People started starting off.
It was
then
allow him.
In China, and all of us watching it, people die on the road. We say, it's too far away or not. Suddenly it moves to Italy. And given the kind of social, like you say, like enjoying themselves,
yes,
it went wild. The U.S. never prepared. And they had earlier dismantled what they call
the health system.
The health system preparedness.
Let him finish. You talk.
Put in place by Obama. It is only now that they were taken away. Our country. The first case appeared when?
On the 5th of March.
5th of March. Today. Probably we should have stopped all planes and all shippings coming into Cameroon way back in February. Probably we did not think we will be invaded. And I think, like he says, it is the role of the state to protect its citizens. And even if its citizens are attacked, to protect it, health-wise or otherwise. And I think the measures that have been put in place, one, carry the mask. It's just one measure. Secondly, keep physical distance.
Yeah, we'll keep coming back to that.
Thirdly, don't do certain things. If you are if a relative of you die, please let the body be disposed in an appropriate manner. No celebrations of births, right? No junkies. And I'm sure that most junkies, like most junkies have been suspended.
Yeah.
Thanks to the more money. But these are the channels through which this disease is going to spread.
Okay.
And unless we get the people understand its impact, and let me tell you that
we'll be getting to the impact shortly.
Most change in most cultures occur when there is an epidemic, when there is a disaster, whether it is flooding, whether it is, that is the time nobody holds on to his behavior. He has to.
Okay.
And I think this is
the time.
The time.
Okay. I'd like us to move on to our next subject, the impact, except you wanted to say something very...
Yes, I just want to give a little practical example for the population to look at it. Just imagine a buy and sell in the market, or somebody who owns a shop and who is not respecting the usage of masks or physical distancing, happen to receive as much clearance as possible in the market area, and you happen to be under a respirator. Where would the money, because we claim we base ourselves on money on daily basis, where would money come from? Normally, relatives are going to spend more than what is being expected. So it's a matter of choice of the population to reflect, to think, do I have the choice of conserving the little I have for now and then be safe for a couple of weeks or months, or rather keep on disrespecting or keep on going about our normal activity without respecting what is there, and again fall now into a serious crisis that will not only affect you alone, but will affect the economy of the state, because coming in even with a respirator is not cheap. These are things that we don't produce here. Other medications that are going to be used, all are not produced here. So when we want to do an analysis and a reflection...
Even when they are produced here.
Yeah, even when they are produced here, the cost is there. Rather than this individual sustaining this period, waiting for this time, and the little that is there, we now invest within our community for more better economic growth. Okay. So it's a matter of us reflecting and thinking on what is very important for the population. And I think the population has the responsibility here. The government might take whatever measures, but as a technical ministry, I always take the direction for the population to be very careful, conscious, and listen to what...
Hold on. Yes. I'll come back on you when we get to the impact.
No, it's not about the impact. It's about the preponderance of people not respecting what is just basic for everybody to know.
Okay.
Because when the government gave an ultimatum about closing bars and other enterprises, those things were respected under very hard circumstances, because the security had to monitor and come in with people hiding behind the scenes and still going to like drink beer or drink whiskey, enjoy themselves, despite all the danger. What is happening here is that what I got to know as a reporter, I moved around to check to know why are people not wearing masks. Masks is just, like Prof said, it's just one of the basics of those areas to curb the disease. Because if you wear a mask, the most important area where you are affected,
they are not wearing it?
They are not wearing masks because the government of Cameroon has made people to look at them as the only place where others can come. People in Cameroon don't reason basically about who they are, how they are supposed to look at themselves, and know that they are very important to everything and everybody in the country. If the government does not come, you can see it when you are driving in the country. If you are driving on any road in Cameroon, if there's no security person around to tell somebody else to wait for another person to pass, even when you have traffic lights, nobody stops. It is the same thing that is coming up with the COVID, where people don't even see the impact, because people even ask, have you even seen somebody who has a COVID? I want to ask you, have you ever seen somebody? Is it really true? You know, those are all embarrassing questions, because when they show you somebody in Italy, where they show several people, hundreds of people or thousands of people dying, and you see covens, I'm coming to say that awareness has been a very big issue about how the COVID-19 is being spread in Cameroon. Okay. If people were aware and people take those into consideration,
we'll come back to the impact.
Okay.
Let's move on to the story coming in from Douala on the situation at La Quintini Hospital.
Okay.
Since the outbreak of the coronavirus, one may be tempted to quickly rush to the conclusion that other diseases have vanished into thin air. Some hospitals, like the La Quintini in Douala, records only 15% of patients that usually visit the health institution. Meanwhile, the patients are many, but most of them fear the unknown.
Some people fear that if they go to the hospital, they will be told that they have coronavirus. Meanwhile, they can suffer from other diseases. My two children at the La Quintini Hospital, but we had no visit from any family member because of the coronavirus. Many patients in the children's ward left without completing their treatment.
The La Quintini Hospital, being the major center that takes care of the COVID-19 patients in Douala, is highly affected by this behavior.
The population thinks that La Quintini now is only doing COVID diagnosis and treatment of the COVID. No, it's not true. We are continuing to be open for the patients suffering from malaria, from diabetes, and the other disease.
For more assurance, the hospital has put in place measures to avoid any contamination in the health institution.
When you have COVID disease in the hospital, you go to another sectors, you can say a particular sectors of the hospital. You are not with the others, in contact with the other patients.
The challenge of health officials is to have a healthy society with healthy persons and not sick people who run away from hospitals because of the COVID-19.
From the report we got from Douala, it looks like people are already stigmatizing COVID patients. Prof.
Yeah, I think so. It's amazing how within a month COVID has taken number one position in the scale of diseases, just from what is...
In the minds of people, not actually what is supposed to be.
Well, in the minds of people, it must begin from there. People don't know actually what it is until it hits home. That's number one. Number two, because they are struggling to make a living, most of them push it to the background until it hits them. The other thing is the effectiveness of our communication strategies, how to reach out to them, how to enforce. Because when you say carry the mask, what is the message we're trying to tell them? That if you wear the mask, you cannot be attacked by the disease. If you wear the mask, you cannot spread it if you have it. I think that's the main objective, and people need to know that. And secondly, socializing is one of the vehicles of spreading the COVID-19. That's all we are saying. And that therefore keeping a distance, avoiding jangi meetings, avoiding death celebration, avoiding birth celebrations, etc. All
services.
Social activities, we should minimize them and probably stay at home and protect our families. And I think, to me, that is where we... The other thing which I thought the ministry should have done, we should have hired more psychologists. Because the biggest problem is the fear. The fear component that is being driven into the hearts of people. You know, with the HIV, when HIV came, you could easily define where the target groups were, and you could easily couch them and deal with it. But the COVID, there's no one single social group that you can say, this is that social group that is going to. Everyone is a potential carrier. And this government must do everything to limit. And if, like I said, change, don't put in measures if there are no sanctions. Because in every society, for every cultural norm or behavior, there is always a sanction. If you don't carry the mask, what is the sanction? If you hold the meeting, what?
You pay 6,000.
You pay 6,000. And if you carry it, if you only have it, you pay 3,000. Well, maybe that's
carrying and wearing are two different things.
But that is not just.
I thought he was talking about wearing a mask.
Yeah, if you wear a mask, fine. You protect yourself and you protect your family. You protect your immediate social environment.
Okay. So yes. Okay. Can we go?
Yeah.
Since everybody wants to say something in relation.
Your question, the question you asked following the report is about how COVID becomes the #1 fearing disease. It is because of death. We see that in journalism. In journalism, one of the key issues that makes us to report a story is about when the death of a human being, especially a very important person, becomes involved. I think in politics it becomes the same as we have our political scientists here. The issue about what makes COVID-19 becomes a very key disease is the fact that if you within 2 weeks or so, you are sure to die when you have COVID-19. That's the reason. That is why everybody who is involved in the hospitals, even the doctors will not tell you that they're afraid of COVID-19 patients. Where you have doctors who are actually nurses or medics who are coming out openly to say we are facing trouble with treating COVID-19 patients. Like in Mexico, where some members of the family attacked.
Okay.
Just to come in.
It did happen in Douala at the Sebek Hospital.
Fine.
Where some people attacked a medical doctor because of a woman who was brought and diagnosed with the COVID-19 and eventually died.
So I will just change it to say, I think Prof mentioned something very key about sanctions. Cameroon has opened up a bit about how to manage a disease, but I think they don't manage the issue of sanctions because many people don't wear the mask again, which is just the key way of protecting. But yet they are not. I don't think they are least sanctioned. But let's go back. I'll give an example. In Gabon, I'll give an example of sanctions.
We don't have much time.
Just a key of sanctions.
You've made your point.
Okay.
I like Doctor to chip in.
Yes, just coming back that from the onset of the disease, we realized that a lot of the population were not believing that the disease do exist. And when once they start getting some of this information, there was that degree of fear. But as a technical ministry, Minister of Public Health, there is a degree of information that has been disseminated. And in collaboration with other ministries, especially the Ministry of Decentralization, the councils have now gotten involved in order to sensitize the population to understand what is actually COVID and what to do in case of a situation. Prof said we could have recruited more psychologists. I can think psychology they might have been in hospital setting because we can't get them generally in the community. But I want to tell you that the communication materials that have been sent to the field were done by psychologists, sociologists, and you can name others because it is a multi-sectorial approach that was used to come up with these facts. So for population neglecting not to get to the hospital milieu, I don't think they really have a fact or a point here because we've made very clear, just like I said from the beginning of the discussion, that the minister actually went to the field to take stock if other services have been closed in health facilities or not. And we see that they are all functioning.
It's
and
the
population,
attitude of the people,
they need
public,
to get back. Perhaps maybe they didn't get the information.
Yes.
But it is high time they get back to health facility and follow up their normal routine. And there is high safety within the hospital milieu for tracing each and every patient and localizing you where you are supposed to be with proper psychological counseling and sensitization.
Okay. Professor Elvis?
Politically speaking, I see a number of impacts that the COVID-19 has on our society. First, we see strong, effective state leadership through the actions of the government and the measures the government has taken. Obviously, we want that they should be stronger or they should improve. There's no doubt about that. But I think you can see that the state has been effective and has been strong. It has not been repressive. It has been liberal. The second impact that I've seen is that the COVID-19 has generated a higher level of national solidarity amongst us. When you see that, and this is an opportunity for me to thank political parties, all the political parties, everyone is behaving as if we look after each other. You've noticed that apart from the MRC incident, which I consider a distraction, generally speaking, all the political parties, civil society, everyone is speaking like we are looking after each other. We are not worried about who belongs to what political party. We know that this thing affects all of us and we are all together, one family. That national solidarity is good. You see people are contributing to the special fund and so forth. That's good.
Well, there's a problem somewhere.
No,
yes.
Please, allow him finish.
The third impact that I see is that this COVID-19 has generated effective international response in terms of how many partners have come to our assistance. Okay. European Union, IMF and others, France, the US, everyone is coming, the Switzerland, everyone is coming to our aid to support the state in what it's doing. I've also seen that it has generated a higher level of policy focus on the public health sector. For some reason, there is a perception that everyone is focusing now on only one sector, public health sector, because everybody is afraid. That's good for the public health sector, and we see that the Minister of Public Health is everywhere. Okay. I think that's very good.
All right.
And the final thing I wanted to say about the impact here is that
a first one
is that this COVID-19 has generated a reawakening on the part of us Africans of the need for scientific thinking on alternative solutions or African solutions to African problems. We have seen what's happening with the Madagascar initiative
for COVID
organic with Monsignor Kleda with Professor Dr. Ndisamba, who's also trying to come up with something with their consortium. So, and other initiatives, I think, in Congo, in Benin, in Togo,
in Gabon, and so on.
Mm-hmm. So, somehow this thing has reawakened the need for Africans to think that Africans can provide solutions to world problems or global problems. That's good for us.
Indeed.
It gives us a reason to believe that we can be a solution and not a problem.
Exactly. Elvis, what are the people saying?
Quite a good number of reactions. We'll go straight to our regular contributor, Mary Kilachin, who says the attitude of Cameroonians against government measures is regrettable, but the government should not be discouraged and the socio-economic problems will be solved. Cho Waters Agnes says the socio-economic consequences are high cost of living, crippling inflation, low productivity, technical employment, disease, amongst others. Tetang Achu says the putting of face mask is the best measure to be enforced as a solution to fight against COVID-19, even if it means forcing people to do so or imposing penalties on those who don't wear the mask. Joacom Augustine says everything depends on the government, and if the government takes serious measures, the population will definitely follow. And
that should be the last.
Benedict Fossa says the focus is the socio-economic consequences of COVID-19 and the government should take strong measures. And we'll conclude with Prince Mutabome Obesa, who's also a regular contributor, who says the measures of treating the way the government treating the different measures is serious, and government should continue, especially ensure that top officials lead by example.
Thank you. Okay. Prof, he just made an observation there concerning Africans trying to provide solutions to a world problem. What do you think about the contributions which Africans are making? And maybe you conclude with your own impact of what coronavirus has done socially.
Definitely, African traditional healthcare system has been neglected. Although a few medical doctors have been interested in it, people like Professor Lamton, who since his work in Q's was to look at how our traditional healers have been catering the population long before the modern health system arrived in this country. And I think this is the time that system which has been neglected but which has been kept alive by many of our traditional healers is re-emerging. Monsignor Kelder, what does he have? He has a small garden of different medicinal plants. It is not COVID-19 that has come for us to discover the good work he has been doing in treating diseases that can be treated in regular hospitals, but which could be treated there at a lesser cost. Therefore, the Institute of Plant and Medicinal Science, Medicine, IMPM, we encouraged it way back in the 1980s to begin to work with the traditional healer so that they can understand whether what they have been doing long before the modern health system had any credibility. Let me just quote an example.
We don't have much time again.
But this example will just to show you that there is a lot in our own system, but we have neglected it. They discover that traditional healers don't harvest their plants during the day. They harvest it at night. Why? Because our scientists discover that at night the plant conserves more of its active ingredients. But during the day, the sun absorbs. The whole process of photosynthesis, it is then that they began to look at those herbs collected at different times in the day, and they began to see the variety in the active ingredients. This was wonderful, and I think this is the work that needs to be continued, and that COVID-19 has just given a breakthrough to what has been done, and probably we need to keep a closer eye on what Kelder is...
Kleda.
Yes, His Grace, Monsignor Kleda is doing, and others within Cameroon as well as elsewhere.
Okay. One last word on the social economic impact?
Yes, there's been a very big one on Africa. Yes, 3 days ago I did a story on Gabon where they are going to lose about 700 billion because of the COVID-19. Why? Because it's a big oil producer on the continent. They are going to lose this money because, in fact, that amount of money is just about 4% of their GDP that they are going to lose. Imagine that it goes to about, say, 10, 20, 50%. Why? Because oil has gone down. Because of the fact that the world markets are not functioning well. People don't come again together to negotiate business.
Okay.
So it puts a problem
again.
Okay.
Maybe the last word. Who takes the last word? Doctor, take the last word and encourage the people.
Yeah, I want to tell the population that based on ethics and deontology, that is why we have been unable to project the image of those who are suffering and actually on high risk. And again, I encourage the population should be patient each time they need some information, either by calling 1510 or either visiting a health facility, and they have been asked to wait because this is a chain. We have some challenges, but we're trying to attend to everybody. They should try and be patient and understand with the medical team and professionals at all times.
Okay. Thank you so much, Prof. and gentlemen, for coming. We call it quit on the program this midday. We did not exhaust all what we thought we could exhaust in terms of the consequences or the impact. I'm sure we're going to come back on that, especially the economic impact. Thank you for being with us on the program this midday. We're looking forward to being with you again same time next month. Stay with CRTV if you can. Tam Tam Weekend is following on CRTV, and on CRTV News, you'll have the news continues.